International Alliance Against Health Risk and Wildlife Trade. My name is Anja and I'm a junior advisor, and I'm very happy to welcome everyone to today's event, Voices from the Ground, with our country office in Vietnam, the GIZ. And our speakers are going to present on what they have been working on, so I don't want to take away too much. But the project has been a 2-year cooperation under the theme of reducing health risks in wild animal trade in Vietnam, where they have been working on inputs for policy and technical recommendations to ensure biosecurity in wildlife farming in Vietnam. We're going to hear more about this in a couple of minutes. I just want to say a few words to introduce our speakers, which is Anja, Barth, and Nhung. So thank you for being here. Anja Barth is the Chief Technical Advisor for the GIZ in Vietnam, and she's working on projects on forestry and biodiversity conservation. And specifically for this project, she has also partnered with the Pandemic Prevention Task Force in Vietnam, as well as other governmental partners using a multi-level approach. And Nhung has 10 years experience on wildlife conservation and trade, where she has also been working for the conservation agency under the Ministry of Natural Resources and the Environment. So she has very broad experience with policymakers and working with governmental agencies. And she has joined the GIZ country office last year under the Biodiversity and Forest Unit. And we also have Ahmed Faiza from the Wildlife Conservation Society based in Indonesia, who's also going to give us a short overview of the results on the project that he has been working on under the Alliance-funded project of spillover prevention in Indonesia with outreach to the Southeast Asia region. So we are very excited to see some synergies, discussions, and thank you for being here. And then I will give the floor to our speakers, Anja and Nhung. Please take it away.
Thank you, Anne. Then maybe we start sharing the presentation from our side. And we don't want to take too much time. Thanks a lot for the introduction, and also thanks for everybody for joining today. We can have a look together at this presentation that we prepared and are looking for it. There it is. And then all the slides and the different windows that are open. I would like to provide maybe a couple of background information on this country package. So this country package is, like as Anne said, is actually a part of the support work that is done under GIZ, also in headquarters, to build up the International Alliance Against Health Risk and Wildlife Trade, and also to manage the secretariat that is currently also there with GIZ. And under this, say, international support work, also some country packages have been set up, and one of this is in Vietnam. And here the focus, that's why it's also like the project name in Vietnam, is reducing health risk in the wild animal trade in Vietnam. And for this project specifically in Vietnam, we have been partnering with the One Health Partnership Secretariat. So this is a secretariat set up under MART, but of course the Ministry of Agriculture and Rural Development, but the One Health Partnership is getting together of 3 different ministries. So the Ministry of Environment and also the Ministry of Health are coming together in this partnership, and the secretariat is hosted by the Ministry of Agriculture. So of course, when we started the work in 2022, that was not the start. So we had some preparatory work in 2021, discussing with different stakeholders. And then, of course, the work also didn't land in a vacuum. There's a lot of work has been done already in Vietnam for quite some time by different projects, by different stakeholders. The One Health Partnership has been very active and also renewed a strategic plan in 2021. So to really say what they would like to do in the next couple of years. And we have also a lot of members of this so-called Pandemic Prevention Task Force that are also active members and founding members of the International Alliance. So like we have also today here WCS, but we also have Traffic and FAO as the key, also partners in this Pandemic Prevention Task Force, which came out during the pandemic as a consortium of like-minded organizations, like-minded people to discuss topics, to bring forward the topic of One Health, specifically when it relates to wildlife issues in Vietnam. And of course, this is one of the key topics that also Nhung would like now to introduce into the next picture, to show a bit where we are actually when we're talking about wildlife farming in Vietnam.
Yes, thank you, Anja. And so I think this part of this slide will help to give you a kind of overall pictures about the wildlife farming in Vietnam, so that you can have kind of general background information to see clearer on our work. So in Vietnam, we kind of different, a bit unique, that we have the wildlife farming quite a long time ago, and based on a study conducted by FAO in 2021, we identify quite a large number of individuals that are being farmed across the country, like you can see here. Here, the total number is about 2 million individuals, and the total number of facilities from wildlife farming in Vietnam is over 7,000 facilities, and the species that are being farmed also vary from common species to endangered and also rare and precious species under the CITES appendix. And you can see that on the right side here, a map that's showing the palm civet farms. You can see that it's located everywhere in the country, every province, except for only one, that in pink color here, that we don't have the farm. So the scale of the farm also varies from small scale, like under 20 individuals, to bigger scale, like more than 500 individuals in the farm. So these situations can tell a lot about, the potential host or potential place for potential risk from the zoonotics. And also another thing about the wildlife farming we would like to share with you is about the key legal framework and also some key actors that involved in the wildlife farming management in Vietnam. For the legal framework, we become the member of CITES in 1994, and then in 2000, I think in 2004, we have the law on forestry, and then after that we have bylaws regulation like degree 32 that regulating the trade and also the breeding and raising of the wildlife in Vietnam. And so these are the very key documents, and that the latest decree that governing the trade and also farming and management of the wildlife and wildlife farming in particular is the Decree 06 in 2019, and is now revised by the Decree 84 in 2021. So in the later slide, when we mention about the legal framework, we will mostly refer to the Decree 06 and Decree 84 relating to wildlife management. And also on the wildlife farming, when we look at the zoonotics prevention and also the unhealth aspect, we also have to mention the law on veterinary medicine. That is also the latest one is in 2015, and also other bylaws regulations. It gives the scope and the mandate on the regulations for veterinary medicine and also animal health care, and also the prevention and addressing of the diseases on animals, of the farmed animals, but mostly on livestock, focusing on livestock, not much clear on the wildlife. So these are the two legal frameworks that our project also focus on in the review work and also in the policy advocacy. And regarding the actors that involving here, we have quite different actors. Like government actors can be mentioned, like the FPD here, Forest Protection Department. These are the agencies that manage all the wildlife farmings in Vietnam, that they play the key role in, registering, monitoring, and also managing the farms. And also CITES Management Authority, they give them permits for export, import of wildlife, and also they develop the policies for the management of CITES appendix species. And Department of Animal Health, of course, to implement the law on veterinary medicine. And we have here the One Health Partnership Secretariat that is set up, as Anja just mentioned, under the MART. That is the coordinating agency that coordinates all the efforts in the One Health work in Vietnam. And they set up the supporting mechanism here, like the specifically for the wildlife farming and for the wildlife area. We have the pandemic prevention, pandemic working groups. That is a technical working group to provide advice for the OHPS regarding the One Health efforts. And we have the Pandemics Prevention Task Force as a smaller group that prepare the working agendas and also the focus of the PWG.
Yeah, okay, coming back to the project. So Nhung just outlined the situation in Vietnam a bit, in which we kind of started to work on this project. It's quite a small project. Let's say the real implementation was around 1.5 years, with some preparatory studies done before that, and also some wrap up like this one that we are still doing. And you see it's like a small team. It's basically us and a couple of also external experts, and with quite also a limited budget. But within this framework, we try to focus also our work, recognizing the situation in Vietnam that was just mentioned, with this more than 300 species being farmed, and also the diversity of facilities in which this is happening. So to look at on the one side, on the policy review, so what is there nationally, was just outlined some key aspects, but also what is there internationally, what can we learn from international best practice, or maybe also not so good practice. And then translate this also in applied research nationally. So what were still gaps that we would like to cover with our project, and then also bringing this back into the so-called multi-stakeholder policy advocacy. So to talk with different stakeholders, they have their own research, they have their own also knowledge and experiences and expertise, and to bring all of this together, then also for this policy advocacy to adjust or at least focus some of the national level policies and regulations that are governing wildlife farms. And then when we go to the next slide, we said, okay, even this is still quite big if you're talking about aspects governing wildlife farms. So if you're looking also in the questions of animal health, animal welfare, these are very important aspects. They're also covered by different projects and actors already. And from our side, then we said, okay, biosecurity requirements in wildlife farms is something that is already an aspect that many projects and actors are working on. And we can support through our project to lift it also to the advocacy level and to add something to what has been done already, and then also to create something maybe more or meaningful from what the joint efforts are done. So we looked into also the international experiences to address One Health issues in wildlife farms, in wildlife facilities or breeding that are breeding wild animals, and then also that potentially different approaches can be taken in this direction, that maybe not one size fits all approaches are required or necessary. And so this is one of the international reviews. This is just a very small glimpse of this. We don't want to go into detail, but we just want to show that this is also, it told us, okay, of course, there's a variety of things that needs to be done, a variety of steps. And within our work, we focus on this biosecurity requirements at wildlife farms. And if we go one step further, then we would like to share what this informed our national level reviews. So the research at the national level and also the policy review at the national level. Maybe Nhung can highlight a couple of topics there.
Yes. And these are some of the key findings that we find upon a number of reviews of the legal reviews on the, two key areas of wildlife management and also the veterinary medicine regulations that we found. Of course, looking at the loopholes or the barriers that can prevent the implementation of the biosecurity measures at the wildlife farming. So for the, you can see here for the registration, inspection, and reporting of the wildlife farming, we find some key issues that can be mentioned here. Like for most of the wildlife farming, we see the absence of animal marking system. That means they don't keep track or monitor the farm's population at individual levels, because this is very costing, so most of the farms, they don't have it. And also the reporting requirements for the farming from the farm owners and also from the local authority that manage the wildlife farm is also unclear. Like even though the regulation
I think we cannot hear you right now. Is anyone else having issues?
Yeah,
Yeah.
we also cannot hear either.
Okay. Nhung and Anja, if you can hear it, we cannot hear you right now. I'm not sure if this is the connection. Can you hear us? Okay, let me maybe put in the chat. Can you hear us now? I think we have some technical issues here, because I don't see that you are muted.
Maybe stepping out and then coming back in will help.
Yeah, maybe. Maybe you can try that. No, Anja, maybe if you leave the meeting and then you come back, maybe this is going to fix the issue. Okay. Let's hope when they come back, there's gonna be all good again. Let's wait.
Hello?
Yes, now we can
Yes.
hear you.
Sorry.
Okay, so how long have you lost it? Sorry, we don't know it. So where
Yeah,
did we? Yeah.
Do you want to share again your screen, and then we can see which point? I think it was. Yeah.
The wake requirements for.
Yes. Yeah.
Okay.
The unclear reporting requirements.
Okay.
On this one.
Yeah.
Okay.
To the slide.
Okay.
Yes. All right.
Okay, so we'll start again with this. So these are some of the key findings that upon our a number of studies. Yeah. So I start with the next one, the vague. In the Decree 06 governing the wildlife farming, is that one of the conditions for setting up a wildlife farming is that it had to meet the requirements on environmental hygiene and pandemic prevention, but there is no detailed guidance on what are the conditions for ensuring environmental hygiene and pandemic prevention is very vague. So it's very difficult for both the farm owners and also the local authority in, appraising and also granting the permits for the farming. And also for the veterinarian animal health requirements, also some loopholes and gaps here, like, as I said, the law on veterinary medicine is also provide quite a good legal framework for managing the disease and also preventing the disease outbreak. But the scope of the law is not really clarified that it can be applied to wildlife. And so in the bylaws, regulations, and also the guidelines, it's just mostly being developed and focused on the livestock. And the detailed guidance and also both technical and also the regulations for the wildlife farming is not there yet. And here the unclear responsibilities, here we mean the role of the Department of Animal Health for supervising and also checking on the wildlife farm is not clearly stated. So the implementation of these agency in reality for the checking and also supervising and even in participating in the checking application or registration of farms is not clearly defined. And while APD, the Forest Protection Department, is the key agency that manage the wildlife farming, but they also don't have expertise and also have detailed guidelines for checking all the conditions relating to environmental hygiene and pandemic prevention, and also the requirements of the collaboration between these two documents also is not there. And the other point is the absence of defined penalties for non-compliance to the, even though there are some requirements on the environmental hygiene or pandemic prevention for the farming in general, but the penalties for the non-compliance is also not there and not strong enough. And also even the enforcement of these penalties is not seriously taken by the competent agency.
I would like to add a couple of points to what Nhung just said. Nhung just summarized the key points that are coming out of the policy review, and part of it is also like the reflection of the research results. So basically what we looked at is like we checked also with farm owners as well as with the agencies that are responsible somehow to verifying or checking these farms, their openness and conditions for behavioral choices, and then also the chances and opportunities actually for then changing something. So if the requirements are strong enough, then maybe we can also tap into opportunities for behavioral choices, or if we are seeing that the behavioral choices are actually also connected to questions of regulations that are not strong enough, then to also work on that one. So we concluded also on some key aspects that actually hampered the implementation of these biosecurity measures and checks in wildlife farms. And if you're looking at one of the practical issues that are hampering the implementation, which were mentioned by the agencies, like Nhung mentioned, from the Forest Protection Department and the Animal Health Department, that would be required in theory to work together to address aspects of biosecurity in wildlife farms, that we see a lack of information sharing with very practical issues that actually the Animal Health Department says, yeah, we actually don't know how many farms are registered under the Forest Protection Department within my province or within my district. So I actually also don't know where to go and what to check. That's a very simple information sharing aspect, but it already illustrates that the challenges there for the implementation. And the other points is also that the unclarity in the documents also then, of course, translates into irregular health and biosecurity checks. So if I don't know, I can actually not really follow up. And then if I don't have the responsibility and for example, for the Forest Protection Department, I will also not do this as the officer because I don't have a mandate, or I also don't even know what to do. One example of the very practical aspects is the animal quarantine topic, so which is actually not compliant. There are requirements, they're also quite clear about what to do with an animal that is new at your farm, also when you transport an animal from District 1 to District 2 or from between the different provinces. But those are, for wildlife farms, very often not adhered to because of these aspects mentioned earlier already. Then, of course, one of the aspects that is also influencing the implementation is the limited capacity of farm owners and vets to actually know the specific condition for wildlife. So in all the districts and also all the provinces, the issue of the, let's say, limited knowledge of veterinarian staff to actually address wildlife aspects or to be also specific to wildlife requirements was mentioned. And then also the limited responsibility of FBD so that they actually don't have certain mandates to check on biosecurity issues in the wildlife farms, while they have the mandate to check the management as such, the overall management of these farms. If you're looking now at the farmer side, there is 3 key aspects that are influencing their choices of how they manage their farm. The first one is the risk attitude, which is quite low, so that the understanding of any zoonotic challenges or risks is basically almost not there. So I have not seen any sick animals, or actually wildlife is stronger than livestock, and these are the kind of feedbacks that are provided. The other side is the access to information and limited resources, so that the farmers actually don't know what should be done, and limited resources relates to the aspect that maybe they know what to do, but they actually don't have enough resources to do this. For example, to put the facility a bit further away from the housing or a bit further away from livestock, but since their ground is limited, then they will just put it next to each other. And then also the regulations and guidance and the perceived control is quite low, or is actually not provided. So also from the farmer side, they say, if I would, that is a theoretical answer, of course, but in principle, there's an openness. If there would be stronger regulations, many farmers also said they would actually follow those. Then this also then informed once more also in international research, where we said, okay, let's look at the policies that are available internationally regulating biosecurity aspects. So around 15 documents were reviewed. And of course, it's nothing new that we see here, because it's quite normal for many different facilities that are farming animals. But it once more summarized everything, and then with this also provided the input to the legislation that Nhung will now present to inform the work that we have been doing, and specifically for Vietnam.
Yes. So as you see that we have conducted a number of legal reviews and also researches, and we identify the problems, the issues, and also come up with some recommendations for policy revision, especially for the mainstreaming of biosecurity measures for the wildlife farming. And luckily this time, also the time that the government is revising the very key document that managing the wildlife farming is the Decree 06. So we take this opportunity and then we work with the policymaker to try to, mainstream and also reflect some of our key findings into this important document. Hopefully that can change and also address some of the gaps and also the weak points in the current regulations that can help to strengthen the prevention of the zoonotic diseases. So in the revision of Decree 06, we work with Scientists Management Authority, and then we think that we find that we cannot intervene in the all documents, so we just focus on the two areas. The first is the chapters are the articles that about regulating about the raising and breeding of the wildlife, and also relating to is the three annexes in the decree. The one is on the breeding plan, the one that farm owners have to fill in to apply for the register for the farming operation. The second one is the monitoring book, the one that farm owner have to, to maintain and fill in information to keep track of their farm population to report to the authority. And the third one is the reporting template. Both the farm owners and the local authority have to fill in the information to, keep track of the changes of the populations in the farming. So these are the key areas that we think that we can work with the policymaker to, to try to revise and try to have it, to have all the, address all the loopholes and also the gaps of the current decree that not, facilitate the application of biosecurity measures as well as farming. We also conduct consultation with the farm owners and the local authorities in Nghệ An province about the revised contents in this decree. And all of these contents have been shared and submitted to the composing team of the decree. And of course, there is, a lot of different steps for the decrees to be, appraised and then approved by the government, from the composing team to the scientist MAs and then the government office and many other authorities. But this is our very first effort in trying to mainstream the biosecurity measures to turn it into the regulations in the key document that managing the wildlife farming. And also, as we said, that one of our approach is the advocacy for advancing the regulatory framework. And this not just done when we found out we find some results, but we also conducted it during our studies that examine our recommendations with the different stakeholders. So we prepared some policy brief that highlighting the key issues that are found out under our studies, and then sharing with the stakeholders, and also we engaging with stakeholders in discussing the recommendations, finding of course, examining and testing, validating the findings, and also discussing with them on the recommendations for policy change through two, consultation workshops at both national and local level. And then we also bring the issue to different, forum, like here you can see. It's one of the annual pandemics working group meetings that we share our findings on the biosecurity measures with all the stakeholders, and then also have their, joint effort in working and advocating for putting the biosecurity measures issue into the regulations. And also we share the different, project knowledge product like communication material, videos, or fact sheets, or things like that with the different stakeholders.
We come to some of the recommendations because, of course, our project is finished now already in December last year. We had a closing workshop. We would like to also with this webinar today to also discuss a bit how things can be taken to the next steps, and some of the key steps that we see is actually to work further on this interface between the regulations that are applicable to wildlife farms, and then also regulations that are setting out the veterinary aspects. So to really that this interface needs to be strengthened, and also the regulatory framework around it needs to be strengthened. And then, of course, this needs to be translated into institutional setups, and then also further technical guidelines. And of course, there's a lot of more of issues that need to be addressed, but that they are not specifically coming out of our project. there's a couple of other issues that already many other stakeholders are working on when we're talking about animal welfare and animal health and so on. But we focus only on what we did in our project.
Yes, and the very last slide from our presentation is we would like to share some of the lessons learned from our work in, policy advocacy for the last 2 years that we think that can be, worth to share with the audience. And the first thing is we think that the identification of entry points for mainstreaming biosecurity requirements into existing frameworks is very important. Like in Vietnam, we reviewed the 2 key legal framework, wildlife management and also veterinary medicine regulations. And we think that we can, with the timing of the revision of Decree 06, is a good opportunity and good entry points to mainstream the biosecurity requirements into the wildlife management framework. So that is one thing, but maybe in other countries, you can also find other entry points that's more suitable with your legal framework. And then also the coordination with and actively engaging policymakers, like with our case, the CITES MAs, right from the beginning, also help a lot in, transferring and also transforming the findings that we have to the policymakers. And the synergy with partners and community of practice like the PPTF or the PWG is also help us a lot in identifying the areas that we need to put the efforts and to avoid any overlaps and repetitive efforts with, other key actors in One Health partnerships effort. And then the research and knowledge and activities that we've done also tailored to what we found from the work from the study and also from the work of our partners. Yeah, thank you. Maybe the time is a bit over, so thank you for your listening. Yeah, and we are ready to answer any questions. Thank you.
Thank you, Anja and Nhung. I think this gave a very good overview of what you've done throughout the past 2 years and also about the policy framework in Vietnam. Thank you so much. Like, one of the things that always also sticks to me is the point that you also talked about with the non-compliance and the penalties, where I feel like if you look at also the penalties for illegal wildlife trade, like it's, I always find it very interesting to see how low or the penalties are generally also in these frameworks or the compliance and enforcement. But anyways, thank you so much. If there are any questions, please feel free to raise your hand, unmute yourself. You can also write your question in the chat. Are there any questions that you would like to raise right now? Yes, Barbara.
Yeah,
Go
thank
ahead.
you, first of all, for your efforts to improve the clearly somewhat chaotic situation in Vietnam, and for trying to at least get policies established that provide some guidance. I have 2 questions. The first one is, I have worked on the CITES context in Vietnam for many years. And although there are very clear guidelines and very strict rules, the adherence, compliance, and enforcement in Vietnam is very low. So the first question is, how do you evaluate the chances that even if you could get your dream regulations in place, that they will actually have an impact? The second question is that we also work on a project in Vietnam with the Buddhist community there to reduce demand for wildlife based on Buddhist principles. And so there's obviously, we're working in 2 different directions here, which is a concern. The question is, do you think that we're given the level of the poor compliance and enforcement, with regard to wildlife-related issues in Vietnam and the lack of awareness about the needs of the requirements of animals to stay healthy and have good welfare and therefore reduce pandemic risks. Do you think that that you might have an enabling role by saying we now have a policy that regulates this so everything is fine, so wildlife farming will actually increase rather than contract in the country? So those are my two questions. Thank you. But I realize that you have a difficult, you are working under difficult circumstances. So thank you for your efforts.
Oh, shall we answer first, Anne?
Yes, please
Yeah.
go ahead.
I think the question of law enforcement is a different one than the one that we have been working on. As I mentioned, that the project was quite limited. It's more to create also platform and exchange between different stakeholders, working specifically on zoonotic like emergence and spillover risks at wildlife farms. So and for this project to have like added value in this already quite diverse landscape in Vietnam that is working on this topic, we focused on biosecurity measures. And if you're looking at what is possible, if you're talking about food security and also aspects on livestock management, you can actually implement it if the responsibilities and the mandates are clear. So there is enforcement in this area if you're only focusing on the aspect of biosecurity measures. If the mandates would be clearer and also the aspects that are required to be implemented by wildlife farms are stricter spelled out, then the assumption would be that this is implemented better, and then also that the related agencies can actually do this. Now, the other question that we also discussed a long time, but when we set up this project and also the focus of the project is what are the possibilities to restrict wildlife farms in Vietnam from different points of view, also from the conservation aspect or from the animal welfare aspect and so on. So one of the also assumptions would be that by raising the standards that are required actually to be able to register a farm or to manage a farm, with this you could also limit the number of farms, also the number of animals that are being farmed. Now we are not yet there, and there's a lot of work still ongoing by different also bigger organizations in Vietnam, so that are still continuing on that path to have stricter regulations, and with these regulations also to raise the bar, and with this also have the limitations in what is possible to be farmed in Vietnam. The other questions of increasing actually wildlife farming through regulating it, yes, could be an interesting discussion. Maybe it's a bit out of the scope of this exchange today. I don't think that the policy framework in Vietnam will change anything in this regard to have it more, because it is already very big and very diverse, and there's a huge demand for that one. So then it's good to work from different angles on this topic of wildlife farming. And of course, demand reduction is one of the aspects. But the question is also there, from which angle are you working on if you're talking about demand reduction? If you're talking from the conservation aspect, or you're talking also from the animal health and welfare aspect. I will leave it at that. Happy to exchange further, but maybe it's not the real focus of this exchange now. But also when you're in Vietnam, please pass by.
Yes, thank you. And of course, if you would like to exchange more, reach out also to the Secretariat, and we are very happy to connect you and discuss further on this. Mohammed Pasha also has raised his hand, so please also unmute yourself and ask your questions. And then after that, I would like to invite you to maybe post your questions in the chat so we can then maybe answer them after so that we can give the floor to Faisal after, and then we still have enough time for our discussion. So Pasha, please pose your question.
Thank you so much. I'm Khalid Pasha from IUCN Asia Regional Office here in Bangkok. And I was just wondering, because some of the recommendations which are coming, how they can be mainstreamed with the ongoing dialogue which is happening in the Quadripartite Alliance, Wildlife Health Alliance, and therefore connected to the wider policies within ASEAN. That's one. And number two, with the work which is already you have showcased in Vietnam, how can we also look at exploring the possibilities of using the 5D sustainability framework, which has been developed on the sustainable consumption and the use of wildlife products by the different organizations, which is the SULI, IAD, and Traffic and others. So is that something which you are also looking at?
We are very happy to hand over this work, Khalid, also to the ongoing project Nature for Health under IUCN. And also I would leave maybe the question on the quadripartite work to maybe to the Alliance Secretariat, how this can be also scaled up to a different level. This project that we are just presenting is closed since December. We are doing the wrap-up work now. We're trying to share the knowledge products, the insights that were created to actually also, we are doing this very actively in Vietnam. So this is part of the work that we're doing with the Pandemic Prevention Task Force and also bringing it to different conferences so that it hopefully fills a gap that we have seen, and then also from there can be taken further. So very happy to see these suggestions. So it would be very good to use these opportunities. We are working on that in Vietnam, and we are also in exchange with the colleagues from IUCN here. And we are also happy to provide this as an input to also international exchanges.
Yes, actually, we already provided our insights and findings for the scoping mission of the Nature for Health in Vietnam, and hopefully that some of our efforts can be continued to be done under the Nature for Health project. Does that answer yours? Yeah.
Yes, thank you. Maybe my colleague Johannes Kai would like to add something. Please go ahead.
Yes, thank you. Based on how, regarding the question how we want to disseminate the results, we are currently preparing a summary report on all of our 17 financed projects. So we had a variety of different approaches being tested in the last 2.5 years. And we also have members from ULEP Secretariat in our alliance, so we will surely disseminate and exchange later this year how the results can further be taken up on the international level. I hope this answers your question.
All right, thank you for clarifying that. If there's still a remaining question, also please feel free to reach out to the Secretariat. I can also post the email in the chat. Otherwise, I think maybe also looking at the time, let's give the floor to Faisal to also give his little input on the project that he's working on in Indonesia. Yes, we can already see your slide. Thank you. And then we can also start with our discussion after. Please go ahead.
Thanks, Anne. Can you hear me? Yeah? Okay, cool. Well, first of all, thanks Anja, Nhung, for your for the insights from Vietnam. I mean, really the situation of the wildlife farming in Vietnam is just it blows my mind. I do have a few questions, but I think I'll save it until for the end for the later discussion. Just for clarification, so the presentation that I will give this afternoon is about the socioeconomic assessment on socioeconomic impact of commercial wildlife trade and the relations to zoonotic risk in the northern Sulawesi region. So this work is actually was not part of the project funded by the Alliance and GIZ. So this assessment was already conducted like 2-3 years ago, but nevertheless, this studies also feed on the policy work that we've been working with the under the GIZ or the Alliance project. We'd be happy to talk more if the Alliance interested. We can talk about the concept now or next studies for this upcoming findings from these studies. So I'm going to provide a little bit of context regarding the study. So this is the background of the assessment. So it's not a rocket science. Actually, I think we all of us here in the room, I think we already quite familiar with the idea with the One Health approach for the zoonotic diseases and emerging infectious disease prevention and control. So 70% of disease detected in Asia are zoonotic. Wild meat for consumption in Indonesia accounts for 1 million, especially for bats or flying foxes in Sulawesi. Commercial wildlife trade for consumption carries high zoonotic risk, of course. Wildlife consumption is the culture of Minahasa community. So Minahasa is one of the ethnics in the northern Sulawesi region, and the economic contribution of wildlife consumption. So this is the gap that needs to be assessed, and the outputs of the study would be the socioeconomic impacts of commercial wildlife trade chains or supply chains, and recommendation for commercial wildlife trade and policy regulation. Yeah. So these are the overview from past studies. So if we're talking about the wildlife markets, wild meat consumption in Indonesia, then all eyes are going to look at that particular region, which is the northern Sulawesi region. So the studies conducted in several markets in northern Sulawesi region. Number of individuals traded increased by 700%. The numbers of the flying foxes and other wildlife species, especially for flying foxes, it's around 600,000 to 1 million individuals per year, and for reticulated pythons, it's 27 tons per year. So this is the general idea of the pricing from the hunters into the middleman or the transporter until it reached to the market and consumers. And this is a quick overview of the research flow, literature review, primary data collection. So for your information, for this assessment, the WCS Indonesia is in partnership with the Ministry of Environment and Forestry and also with the University of Indonesia. So the teams that conducted the primary data collections from the university, they're from the anthropology faculty, so their insights would be most heavily to the anthropogenic point of view, which brings more a diverse point of view to the assessment itself, which is really important. So this is the list of villages and markets in North Sulawesi and Gorontalo that's been surveyed. villages, 7 villages in northern Sulawesi. So northern Sulawesi has two provinces, the North Sulawesi and Gorontalo, and this is the number of markets on the name of the markets that being surveyed as well in the northern Sulawesi region for this study. So to put things into context, so this is the lovely Indonesia country. So Sulawesi is the this one particular island with similar shape as a K letter here. And the main findings of the study or the assessment is quite interesting. As you can see here, there's a lot of arrows pointing back and forth, vice versa. So this would be from the findings of the from the studies provide three stages of the wildlife trade supply chain from the production or from the harvesting into and the second one is the transport, and then to the next one, the third stage would be in the markets or in the consumer. So what we found from the study, from the assessment, is that the flow from the hunters it can go directly to the markets, but it usually goes from intermediary first, like the transporter or collector. We call it collector. But as you can see here, there is a lot of flows that cannot be controlled, or it's not following the main flows, which is quite interesting for us. So the flow from the flow of the wildlife products goes from hunters, the collectors, and into the consumers, which is it could be restaurants, it could be markets, or it can goes to the consumer directly. So this is a couple of documentation from the study itself. One of the main findings during the study is the most traded wildlife species in northern Sulawesi is one is the flying fox, which is not a surprise because there's a lot of demand, high demand for flying foxes in the region as well. And the second species would be the rats. It's the forest rats. So the findings actually from the studies shows that the supply for wild meat products in the North Sulawesi province came from outside of North Sulawesi itself, because the demand is really high in North Sulawesi, and let's just say that in Northern Sulawesi, in North Sulawesi province itself, they couldn't find any more. They couldn't meet the level of supply that can meet the demand in the province. So lots of wild meat products coming into Northern Sulawesi from outside Sulawesi. It could be from other Sulawesi provinces, but it could also comes from outside Sulawesi, for example, from Borneo or from other islands, or possibly from abroad itself. So this is the northern Sulawesi region. This is the North Sulawesi province, and this is the Gorontalo province. The other findings from the assessment, from the study, also there are several villages that were identified as the main supplier for wildlife products in North Sulawesi. and that villages are located in the Gorontalo province, which the government needs to have a broader overview or broader assessment, not just in the northern Sulawesi region, but also needs to include areas outside of North Sulawesi if the government wants to address this issue. And these are the recommendation from the studies. So the first one is to increase responsibility ensuring wildlife conservation. From Nhung and Anja's a presentation, I believe there's a law like in Vietnam that needs to be revised. That's the same thing happens in Indonesia as well. We have the natural resources and biodiversity conservation law, which dated way back to the 1990, which is not relevant again. It needs to be revised, but again, political situations plays a heavy role in it, so that the government failed to revise it over the years. But still, it's under the national priority for revisions. We just need to keep pushing for the revision to take place in the coming years. The second one is to accommodate community participation and keep conflict to a minimum. Of course, if we're talking about the wild meat consumption, then we're talking about we're talking about religion. We can talk about ethnicity. There's a lot of factors comes into play. So in addressing this issue needs to have a lot of perspective and also lots of strategies as well. And the overall recommendations from the studies to, like I said previously, extending the scope of the study to other Sulawesi areas. Conducting seaport assessment to assess the supply of wildlife and the wildlife routes from neighboring Indonesian islands. Expanding the data collection to gather more in-depth information on traders and consumers' zoonotic risk. Conduct genetic sampling to assess zoonotic diseases risk along the supply chain, and developing a policy white paper which to inform the policymakers regarding the wildlife trade and animal welfare within a One Health framework. So in relate to the situation in Vietnam, here in Indonesia, we have the Ministry of Environment and Forestry as the wildlife authority. The Ministry of Environment and Forestry is also the CITES management authority here in Indonesia. And then we have the Ministry of Agriculture, which regulates all of the livestock and pet animals as well. So we do have that kind of gaps regarding the management of wildlife and livestock, because usually because here the Ministry of Environment and Forestry does not have a veterinary authority. The veterinary authority is under the Ministry of Agriculture. So it clearly resulting in a huge gaps in a wildlife ex situ population management, especially in terms of we don't have wildlife farming here in Indonesia. We don't call it that. We call it a wildlife breeding facility, but it's on the same business. I think But compared to the Vietnam, I think the scale of the wildlife farming or the wildlife breeding facility here in Indonesia is very different. I think from based on the presentation from you, Nhung, and also you, Anja, I think the level of the wildlife farming in Vietnam is way higher than in Indonesia. We do have a couple of breeding facilities, companies across Indonesia, but the wildlife products coming from that breeding facility, from that facilities, are rarely or never been to meet the domestic demand. Most of the maybe entire the facilities send the products abroad for export, not for domestic demands. With that, I conclude my presentation. Thank you. Back to you, Anne.
Yes, thank you so much, Faisal. This was also a very interesting overview of the situation in Indonesia, and I think it's very interesting to also see what you've like also put now, and I think in your overall recommendation under point 3, and what we've also seen in Vietnam. What I find always very interesting is kind of the data availability that, like, to me, it seems like such a straightforward thing that you could do, and there's still like a lack of data and data sharing. And also I think the aspect of the kind of also international trade, like not only domestic or regional, but also how the trade like interacts with different countries, or import export. Very interesting. Thank you. Then maybe if there are any very pressing questions to Faisal, maybe you can raise your hand and post them, or put them in the chat. And otherwise, I think we can maybe use the last 20 minutes to look at our discussion questions. Okay, otherwise, raise your hand if you have any questions. Yeah, Alice?
Yeah, thank you so much for the great presentations. It's not pressing the question, but it's a question. So I was very impressed by this heat map, like risk heat map that you showed. And I just wanted to understand if there is a possibility of, if it's too complex, to have gender disaggregated data, because I assume that the between hunter, consumer, and collector, there might be like gender differences, which would also reflect in the risks affecting, the health risk affecting women and men differently, I assume. But I know it's not always easy to gather gender disaggregated data, so I just wanted to know what your take is on this.
Yeah, I think the research team also look at the gender issue as well. I think most of the actors are male, as suspected, from the hunting into the collector, and so but the markets are usually dominated by females. I think the most part of the parts that we deem is the most highest risk for zoonotic diseases transmission is from at the hunter production, harvesting, and into the collector. Whereas in the markets or restaurants or in the consumers, they usually receive the wildlife products. They usually receive it already in in the wildlife products, not like in the live in the form of live animals. So the risk, the highest risk would be the highest risk is in the production side, the harvester, the poacher, the hunter, and then also at the collector sites. but not on the markets or the consumer stage, which is dominated by female. Most of the traders are female usually.
Great, thank you.
So yeah, it's really interesting to see that correlation.
Yes, thank you. Ricardo, do you maybe want to unmute yourself and pose your question before we're gonna dive into the discussion?
Yes, thank you. Best compliments, absolutely best compliments, Hamad, sorry. Thinking you have a checklist, you talk about that. Is it possible quantify frequency of health controls and checks carried per month, or if you want per year, carried out by the official authority? Because of course the problem of the controls global and respected the condition of One Health is very important now in the past time, and of course in this moment is very important. Thank you so much.
Thank you for the question. Yeah, I think I'm not quite get which health check conducted to by whom and to what, to the wildlife products, to the wildlife, or to the societies, the society members.
Yes, correct. Your response, but my idea is quantify the situation global regarding in general markets and products carried in the market and have present in the market, and of course in general in the situation you talked on a person in the market and passage of the person and other global situation, considering the control applied with by health authority. Thank you.
Yeah, that is something that we definitely are looking at as well, and then we want to we've been giving that recommendation as well to the government. The thing is, in regards to One Health, especially in the zoonotic diseases and IDs control and prevention, we're still taking the baby steps at the moment. We do have health authorities, the public, the animals, environment, but they each of the authorities has its own agendas and priorities. For example, for animal testing or wildlife testing, it should be conducted under two different authorities. So Ministry of Agriculture for livestock or pet animals, and then the Environment and Forestry should conduct testing for wild animals. So those kind of authorities and specific roles between each ministries that currently are the gaps that needs to be addressed. We do have a couple of new regulations regarding One Health in general, but especially in zoonosis and IIDs control and prevention. But it's quite a new regulation. It's only issued in 2022 after COVID, so it's still going to take quite a while to be actually implemented. But yes, I think in the general idea is to kind of have that kind of a health surveillance, if you may, in that specific human wildlife interface that can cause very high risk of disease spillover or transmission. I hope it
Thank you so much.
it
Thank you
answers
so
your
much.
question. Yeah.
Thank you. All right, let's maybe use the rest of the time to dive into the discussion questions. Nhung and Anja, do you maybe have a preference on what we should start with? Which question? You want to start just with the first one, or maybe you have another preference?
No specific preference, and as you see, the questions are very much geared to this aspect of biosecurity measures at facilities breeding wild animals. Would just be interesting to listen to maybe feedback from the audience, if there's any experience, if people are working on the policy aspects. We know that in many countries are people actually working also on the ground, directly with farmers, directly with the authorities that are implementing regulations. But it would be interesting to see also if there's anything that you see from your context with regard to maybe the collaboration, as also Faisal just mentioned, maybe regulations are not clear enough to implement measures or also to check measures, because also the question of who is then responsible for what. Yes, so please, if there's anything that you would like to mention also on voluntary or mandatory guidelines specific to wildlife farms, if this is existing or not, and what is your context and lessons learned maybe that you can bring into this exchange.
Yes, thank you. Yeah, if there's anyone who has some thoughts on this, experiences, please raise your hand, unmute yourself. Yeah, I think it would be very interesting to see how it's different in several countries, because I think also another very interesting point is that, you know, what you also mentioned, Faisal, I guess that, you know, you have kind of a bit of the same concept as wildlife farming, but it's just not called wildlife farming. So if there's maybe any experiences, but I also see a hand. So Patricia Tehel, maybe you can unmute yourself and share your experiences and thoughts. We cannot hear you yet. You're still muted.
Hi.
Yes, no, perfect.
So Tanzania has an assortment of wildlife, and a lot of the bushmeat wildlife here is larger macrofauna. I mean, impalas, huge bushmeat markets here. And recently the idea of, so in wildlife farms, we have it more as wildlife captivity facilities. So when an animal is taken out of nature for 1 minute, 1 second, 10 years, 10 days, either for any kind of utilization, there is no farming. There was farming here, but they're starting it, and they also have wildlife butcheries here. The same thing that you brought up is the Ministry of Livestock and Animal Welfare Acts that have been enacted here in Tanzania, but the animals that are excluded from the Animal Welfare Act, all livestock are included, but wildlife and fisheries are explicitly excluded, because in this country they have the idea that wildlife are a commodity. Something you can make money on. There is hunting, professional regulated hunting. People can come in here and hunt animals, and also local people can hunt animals. But in the bushmeat, in the illegal sector, the handling is large scale, and it's more secretive. And so what we are saying is that if you have the animal welfare and also motion 135, the word well-being to the animal was added in that motion of One Health, in that the idea that the way you treat animals, even if you're going to eat them or consume them legally, illegally, is that there are these ways of basically the 5 measures of when you handle an animal in captivity, you know, the feeding them and sheltering them and keeping keeping them healthy keeps the environment and the exposure of the handlers healthy as well. So there is, so basically in policy sector, when the governments, until they recognize that wildlife are actually, you know, have the same rights as livestock. Just like a butcher, you can't butcher a cow unless you have an inspector come and look at the meat. But when you butcher an impala or an eland, there is no inspector because it is this animal is under a different ministry. So I just found it very interesting that the psychology of an animal as a commodity triggers a different way of creating policies. And we have to, as the One Health movement, say that every animal, if handled properly, the disease will be controlled. And those animals then, people don't want to say, oh, they have rights, but there's the ability to handle them in a way to control infections and human health. So that's really important. And I think in the policy part of wildlife, if you have an animal and you're doing wildlife and you're breeding them, you're going to make a lot of money. It's really great. But even the CITES, when they come on site to count the animals, they literally just count how many animals you have. They don't see if the animal has disease or if the animal is sick or the animal has a disease. CITES is basically, if you have an endangered species, we're just counting if they're still alive. And I think that's where the discussion is really advocating with the government that regulating human health is important in regulating the health of the animals that are held in captivity.
Yes, thank you so much for sharing very interesting insights also from a different region, but I guess you can see some similarities there. I don't know if Nhung and Anja, if you would like to maybe respond, or if Faiza wanted to say something as well.
Yeah, I just want to add regarding question number one. Here in Indonesia, WCS usually we rarely involved in the ex-situ population management because to the nature based on from the nature of our work, we mainly focus on the in situ settings, if you know what I mean. So we're talking about supporting wildlife from wild population. And in terms of wildlife farms, we don't in Indonesia we don't have wildlife farms, but in Indonesia we do have like ex-situ population facilities such as the wildlife rescue centers, breeding facilities. We rarely touch on the wildlife breeding facility programs with the Ministry of Environment and Forestry because usually the breeding facilities are driven by the economy purposes. Their main purpose is to sell the wildlife products, usually to abroad. But I think our ministry here has strategy to conduct to have like guidelines for managing ex-situ population, including wildlife farms or wildlife breeding facilities. But I think the most glaring gaps would be the monitoring of the wildlife farms or the wildlife breeding facility itself, because they're rarely being monitored upon their activities. What kind of a breeding plan that they have for the next 5 years. At least that's the main problems that we have here in Indonesia. We are very, very suspicious that the breeding facility are also receive wildlife that being harvested from the wild population as well, which is usually what's the point of having a breeding facility if they're still harvesting or hunting the wildlife species from the wild population, right? So I guess we don't have any experience in advancing policies and biosecurity measures, especially in ex situ population. But we do have a couple of guidelines for the ex situ population, which is usually being used in under the in wildlife rescue centers or wildlife rehabilitation centers. In regards to question number 2, I think I completely agree that we need to involve other sector as well, especially the public health sectors. I think in a sense, I think we need to be able to push the health issues needs to be addressed from the wildlife health as well. I think learning from the COVID pandemic and then other diseases as well here in Indonesia. I think the Ministry of Health is now paying more attention to the surveillance and monitoring of suspected wildlife species that can carry a highly consequence pathogen, which is really resonate well with biodiversity conservation as well. And for the third questions, we don't have that. We don't have the mandatory or voluntary guidelines specific to biosecurity measures. Wildlife farms, but I think the biosecurity measures or SOPs or guidelines, it's not that different, or maybe it's I don't think it's different at all from the guidelines or or measures being implemented at the farm settings. So I think using the same standards as at the farm setting would be already adequate with of course with some tweaks in it that can be adjusted to the wildlife species or other settings as well. I think that would be my comments and inputs.
Yes, thank you so much. Is there anyone else who would like to share their thoughts still? Or maybe Anja and Nguyen, you also would like to respond to what has been said?
Yes, I think I can have some response to Patricia. I think I echo lots of her comments, especially on the conservation aspect of the CITES. And like in Vietnam, the wildlife farm is put under the management of CITES, so they only look at mostly the focus on the conservation aspect, to ensure the captive population doesn't affect the natural population, or even, keep the endangered species there, or something like that, to count it. So it's put as I feel like it's like isolation zone. It's not in relation with others, important aspect like animal health or veterinary care, or even the zoonotics prevention. They just stand beside without, close collaboration. And even though the degree, 06, starting with the degree 34 in Vietnam, we have in 2006, but the veterinary medicine regulations is not, advancing together with the emergence and development of the wildlife farming. That's why it's still now like a kind of stand alone as, conservation issues only, management for that purpose only, not looking at the, health risk or things like that. That's why, and also looking at the, economic aspect, as you say, the export of this industry and the revenue is huge. So if you want to look at the economic aspect. You don't want to create too many conditions to, you know, to limit its development. So biosecurity measures, even though we see that it's very good, that we should have it in place, but how to do it, we lack of knowledge, for example. And then if we do it, what will it affect to the industry? Is also, you know, limit the application of this into the regulations. Yeah. Jen, you want to add any?
No, I think that's very interesting points, and also just to add the where Nhung just mentioned, where also the regulations are coming from. Of course, they're coming from 2 different sides or even 3 different sides, and they did not meet anywhere in between. So that the regulations that are somehow applicable to wildlife farms are actually the ones that are supposed to regulate rescue facilities, or this kind of breeding centers that Faisal was just mentioning, but not this commercial scale of wildlife farming for eating or for any other purposes. And this has not matched up at all. And I appreciate the point made about also the animal welfare, that this is not at all extended yet to wildlife also. That is the same in Vietnam, and the regulations that basically would regulate the rescue centers somehow, but you would not regulate wild animals that are kept for the purpose of slaughtering or for consumption only. So I think we are actually over the time. I think it's very interesting exchanges, and I see also a lot of similarities in the different country contexts, of course, coming from different points of view or different starting points, but at the same time working in the, hopefully in the similar direction. Yeah. Thank you.
Yes, thank you so much. And indeed, we are 4 minutes over time. If there are very pressing things, maybe you can, very quickly, I don't know if maybe you have to leave, because otherwise I would maybe suggest you can send us an email and then maybe connect at a different time, because I'm not sure, maybe people have follow-up appointments, so I don't want to keep anyone in here. We're already 5 minutes over time. So yeah, please reach out. I've put our email address in the chat. And then maybe Anja, Nhung, and Faisal, maybe do you want to maybe say last few words, or otherwise, I already want to thank everyone for attending on behalf of the Secretariat. Also, thank you so much, Faisal and Anja and Nhung, for presenting very insightful discussions and input on the frameworks and the policy work that you've been doing in your projects. Thank you so much. And please feel free to reach out to us and we can connect you further. And then hopefully we can continue this discussion. Thank you so much.
Thank you also.
Thank you.
Yeah. Thanks for the exchange. Have a nice day.
And you.
Yes.
Bye.
Thank you.
Bye.
Bye-bye. Thank you.